Hello all, welcome to Group 4's Community Health Project. We chose to use the community of Jacksonville, North Carolina for our community health assessment. Jacksonville is located on the coast of North Carolina, close to the Outer Banks. It's the 14th largest city in North Carolina and is home to Camp Lejeune and New River Air Station, pretty large military bases. It's also the youngest city in America, has a median age of 22.9. This demographic becomes significant when we start getting into the health issues and other factors that this young age brings about in this community. We'll start off with the community assessment. We did a windshield survey, a secondary survey as well. Some things that we found out. It has 81,612 residents with a median home cost of $141,000. You can see the breakdown of sexes and races in the area. Its primary industry is retail sales and service. Due to the military bases, there's a lot of retail outlets there in Jacksonville. With a median household income of $43,000, unemployment rate of 5.9. Crime rate is 32.5 out of 1,000, with this being 82% higher than the national average. Again, due to the young nature of the city and the county, this contributes to this. Some housing options that we're seeing have homes in both urban and rural areas. A lot of mobile homes, some low-income housing. They have senior housing as well, assisted living centers, skilled nursing homes. There's a homeless shelter and a lot of hotels. Again, due to the transient nature and large military bases. A couple pictures kind of give you the sense of housing options. Jacksonville also has some limited transportation options with a public transit that runs in the downtown area only. Has a small airport, private ambulance service, and taxi, and a lot of privately owned vehicles. A couple of transportation options here. You can see in one picture that there's a traffic jam. This is another significant issue with Jacksonville. Again, due to the young nature of the city and the large number of people on the military base causes a lot of traffic congestion. Some industry in Jacksonville. Stanadyne. It is a fuel additives manufacturing employer. It makes octane boosters, chemicals, and also fuel injectors. It actually manufactures its own fuel delivery systems. There's turkey hog farming. A lot of retail, Walmart, malls, a lot of your major big box stores are in Jacksonville. Federal government, obviously, state is there as well, and another major employer, Onslow Memorial Hospital. A couple of retail outlets and some city stuff. with the state being one of the large employers, there are a lot of public safety positions in the county. It also has a city police department, and then the outlying areas are in the county sheriff's jurisdiction, highway patrol for some of the major highways, and there are multiple fire departments, both paid and volunteer, in the area. Again, due to the rural nature, fish and wildlife officers are present. Looking around town, there's quite a few restaurants. Again, all your major big fast food restaurants. A lot of your major grocery stores are in town. There are some community services for food availability. They have Meals on Wheels. There's a food kitchen, which serves free meals to pretty much anyone that walks through the door. And there are several food cupboards that operate like a grocery store. You can come in during their hours and fill up a grocery bag. There's also a farmer's market in town. Some healthcare options: Onslow Memorial Hospital, 162-bed community hospital, and Naval Hospital on Camp Lejeune, 117 beds. It offers emergency room and quite a few other services. There is a mental facility, Bryn Mawr Mental Health Hospital. It offers acute short-term inpatient care, mainly accepting those with insurance and Medicaid, Medicare on a limited basis. There are multiple primary care offices. There are some eye care clinics, increasing urgent care centers, chiropractor offices, and a few pharmacies in town. A couple pictures of the major ones. There's also some education. It has a few public and private schools. There's a Coastal Carolina Community College, and there is a community college on base. And this is tied in with the Illinois State University and Campbell University. There's also Miller-Mott. It's a technical college. There are a few churches in the area. Only one Catholic church, and 3 synagogues. Again, due to the young nature of Jacksonville, a lot of entertainment, theaters, bowling alleys, bars, a few strip clubs, golf courses. There's a beach, both on base and a public beach. There's a senior center, which offers dance, piano classes, and community health services. A lot of parks, a lot of workout places, and a couple public recreation centers. Again, due to the rural nature, a lot of fishing and hunting goes on in the area. So that was the windshield survey. The secondary data analysis, we used the Onslow County State of the Health report and the Onslow County Health Assessment report in the secondary data analysis. And some of the findings we found, again, it's the youngest city in America. This, with the young nature, an interesting fact was suicide was the number 2 cause of death in ages 20 to 39 in 2011. and 54% of survey respondents believe that PTSD is a major problem in the community. Again, this is due to the lack of data, the true status of mental health, behavioral health in the community. It begins to be difficult to assess. There's also, again, due to the young nature of the community, a lot of excessive drinking. Onslow County has a 7% rate of excessive drinking, that is higher than North Carolina in general, with a rate of 5% there. Also, 38.2% of county residents again identified mental health issues to be a primary health concern. In Jacksonville, prescription drug abuse, overdose surpassed MVC, and accidents become the number one cause of death from intentional injuries in 25 to 64-year-olds. This is significant just due to the fact that this is higher in this area than the national average. The Healthy North Carolina 2020 objectives related to mental health reduce the suicide rate from 12.4 to 8.3 per 100,000, decrease the average number of poor mental health days from 3.4 to 2.8, and reduce the rate of mental health related visits to the emergency department from 92 to 82.8 per 10,000. These goals become significant for Jacksonville because they highlight some of the areas of need. Again, just from the secondary data analysis, this is a major issue for this area, both perceived and real. And again, some of the things that came from this, looking at this data, is that, again, a young community. It has a lot of diversity. Just again, due to the military, bringing in a lot of different people from a lot of different areas. The military presence also presents some unique challenges for the community to overcome. Again, just the youngness of the community and the transient nature. We also found that the diverse population and military presence with their diverse backgrounds and also has a unique ability to bring in many perspectives that can overcome these challenges. Some major issues, again, is an increasing need for mental health services and safety and behavioral injuries related to psychological problems. We also did a key informant interview. We interviewed a gentleman named Bob Bandy. He's a retired military. He's lived in Jacksonville for 21 years. He's married to a nurse who works in a local hospital, so they have a hand on the pulse, you could say, of Jacksonville. He's raised his daughter in the community. Again, his concerns echo the findings from secondary data analysis. He identified a need for mental health services. He identified increased crime rate. He said this was due to an increase in drug arrests in the county. He also identified the difficulty that military members have receiving civilian services. This is due to, unless they're referred by the VA, they can't get outside mental health services. This is compounded by the fact that there are a low number of mental health care providers, practitioners in the area. So if they get a referral, getting into one takes a long time. He also identified a lack of adequate treatment for military members for mental health issues. This is a direct quote from him. Military tend to over-medicate members with mental health problems versus actual best case treatments. Military, as he referring to doctors, tend to discharge personnel before they receive the adequate care. So he identified a lack of specialist care and identified one strength in the community as he has noticed an increasing number of healthcare services with the growth of urgent care centers and some large medical office building construction on the main highway. So with all that, we came up with some diagnosis and interventions to help with the growing mental health care needs in Jacksonville. So we identified a couple of strengths in doing this. Again, multiple urgent care facilities and hospitals available. There's a lot of outdoor recreational workout facilities to help with mental health, physical health. This, again, can help with your mental well-being. There are a lot of educational facilities. Again, having a goal and being able to accomplish it through education can help with your cognitive health. There is a lot of areas don't have a mental health hospital to treat acutely ill. You have to go outside of your area. Jacksonville actually has a mental health hospital. Again, there's multiple agencies in town for crisis prevention and substance abuse help. And the issue becomes the number of people who need it versus the number of facilities and agencies available. And we also identified some weaknesses. Again, the lack of availability of the mental health services, again, due to overcrowding. There is a low income, high poverty in the community, and lack of medical specialists in the area, mainly mental health providers. They have to go outside the surrounding area for care. And a lack of national and state data to determine the actual effect of the mental health disorders. This is also a national issue as well. So from our assessment and analysis, some major health issues for Jacksonville are heart and cerebrovascular disease, again, are the leading causes of death, but suicide and homicide are higher in Jacksonville than the North Carolina average, again, due to the young nature and military presence. There's multiple pollutants from nearby farming, poor sewage. This can lead to infectious diseases. Again, prescription drug abuse. This was found to be the number one cause for unintentional injury among 25 to 64-year-olds and was significantly higher than the national average. Diagnosis that we came up with for Jacksonville, there's an opportunity to improve the mental health in Jacksonville, North Carolina, of both military and permanent residents ages 20 to 55, related to increasing awareness, educating family and individuals about the signs and symptoms of deteriorating mental health, increasing funding of both outpatient and inpatient mental health services, as evidenced by the suicide rate, poor mental health days rate, and visits to the emergency room for mental health rate will decrease to healthy North Carolina 2020 goals. So, again, in determining if this is a potential or actual health issue, we determined that it was an actual problem for the city of Jacksonville. Again, suicide being the number 2 cause of death in the age group. 1 in 5 community members reported excessive drinking. That is equal to more than 1 or 2 every day, or 4 or 5 drinks at a time on a monthly basis. Prescription drug abuse, again, this could be due to the inadequate treatment that the key informant told us about, just giving people with mental health issues large amounts of medication lead to abuse. And again, something that was in the news, it was a recent homicide in the city. He had a long-standing history, well-known to the community, of mental illness, and he actually, because of the lack of ability of the community to get him help, he killed someone, which is a tragedy. Some areas that are affected by this mental health issue, again, the military bases, they are most highly affected due to PTSD and the increased traumatic brain injuries due to the ongoing operations overseas. Again, it's home to the Marine Corps base, Camp Lejeune, and the Marine Corps Air Station New River brings in a lot of military members. And a large number of mentally ill patients awaiting placement institutions. This affects the outlying community and the emergency department at Onslow Memorial. It takes up bed space of acute physical illness. Interesting fact, I actually used to work in the Onslow Memorial, and I can personally speak to this. They house 4 to 5 patients per shift for multiple days waiting for a mental health bed. Again, this housing in the emergency department is just provides inadequate treatment for them. That is a topic for another PowerPoint. So moving on, the community level of awareness. They are acutely aware of this, as 38.2% of residents recognize mental health and depression as a primary health concern. 54% of respondents to a community health assessment report that PTSD is a major problem in the community. Some issues considered by the community to be a high priority: reducing the suicide rate, and increasing the ability of the agencies to treat mentally ill. Again, there are Bryn Mawr is available. Coastal Care Call Center is available for crisis intervention. And the Naval Hospital has an inpatient mental health unit for veterans and active military members. And there's a new Wounded Warrior Complex available on Camp Lejeune for military men and women. So some interventions that we thought about to improve some of the mental health of the community. Again, increased spending on mental health facilities, either increasing their bed numbers, and giving them assistance when they get discharged from the ED, case manager, frequent check-ins, revisit, or on the phone. Just getting a good follow-up can significantly help these people get the services they need. Again, establish a hotline for crisis prevention, having place for people in crisis to call and get information on where to go would help. Generalized education for the community, giving them signs and symptoms of depression, PTSD, and again, what treatments are available in the area. This ties in with, again, providing more space and providers to treat mental health, and increase the number of support groups for military members and their families. Some formal interventions that we came up with, a primary, again, targeting the military members and families, education, provide around the community for the signs and symptoms of PTSD, increasing the resources for treatment facilities and coping methods, and creating some brochures that can be placed around the community to present the information. Step one is admitting that you have an issue. Step two is finding out where you need to go, and sometimes that can be an issue, knowing your resources. Secondary, early intervention is necessary with military members and families to teach them what to expect before, during, and after returning home from deployment. This will give them an idea of what feelings to expect and to help in dealing with the changes that occur. Another method could be to create counseling groups, be able for them to kind of help talk about their feelings and issues that they have during combat, and help coping mechanisms to prevent depression and substance abuse. Tertiary, advocate to local and state leaders for, again, increased funding for mental health facilities. Explain the burden that mental health illness places on the community through suicide, homicide, increased crime. Explain the strain that is placed on local emergency departments who are housing mentally ill patients while awaiting placement in treatment facilities. These are our references. So I hope you've enjoyed the presentation. I hope it helped highlight an issue within Jacksonville, and get you to think about some of the issues in your own community.